Hi, I am Dr. Sweta Gupta, Clinical Director of Medicover Fertility. Today's topic of discussion is thin endometrium, its symptoms, causes, and treatment options. What is thin endometrium or thin lining of womb? The thickness of endometrial lining is important for women who are trying to conceive or undergoing IVF cycles. For an embryo to go and implant in the endometrium, it should be thick, receptive, and nourishing. An endometrial thickness of 8 mm or above is considered normal for successful embryo implantation, and a thickness of less than 7 mm is considered as thin endometrium, which decreases the chances of successful pregnancy. What are the symptoms of a thin endometrium? The symptoms of thin endometrium are abnormal menstrual cycle, reduced menstrual bleeding, painful periods, infertility, or can be without any symptoms and detected on ultrasound. What are the causes of thin endometrium? The causes of a thin endometrial lining may be due to low estrogen level, inadequate blood flow to the uterus, poor health of the endometrial tissue like endometrial tuberculosis or pelvic infections, DNC or any other surgery leading to adhesions or scarring, use of birth control pills or fertility drugs like Clomid. How can thin endometrium be treated? Proper evaluation of the endometrium should be done and treated accordingly to make it thick and nourishing so that it can accept an embryo. Firstly, an ultrasound is done to check for the thickness of the uterus. In some cases, hysteroscopy is required. If during the procedure we find any intrauterine adhesions or scarring or adhesions, then they are removed. Infections like endometrial tuberculosis or any other pelvic infection should be treated with medicines. Estrogen tablets. Estrogen hormone is vital in maintaining the endometrial lining, so a woman having a low estrogen level can be treated with estrogen supplement either orally or as a suppository. In addition to this, some newer techniques like granulocyte colony stimulating factor, which is a growth hormone, and its intrauterine infusion has been seen to increase the thickness of the endometrial lining. And lastly, if during an IVF cycle it is found that a patient has a poor endometrium, then it is recommended to freeze all her embryos in that cycle and transfer later once the endometrium has thickened and ready to accept the embryos. We can also check the receptivity of the endometrium through a molecular diagnostic test, which helps to locate the implantation window, so a personalized embryo transfer can be done to reduce the chance of implantation failure. How can Medicover Fertility help women deal with thin endometrium? Medicover Fertility is a renowned European brand with 23 years of experience in the field of infertility. We have a team of highly skilled and experienced doctors who help couples to deal with fertility issues. We have successfully treated many women who had recurrent miscarriages and many failed IVF cycles due to thin endometrium. So thin endometrium is the biggest challenge faced in IVF industry, but with advanced techniques and careful evaluation and treatment, these women have been able to conceive successfully. And in women who have a severely damaged endometrial lining, surrogacy can be an option. Thank you for watching this video. If you have any questions or concerns regarding thin endometrial lining, you can drop your questions in the comment section or call us on 7862 800 700.